Within this video is the veterinary first aid care and what it contains. The aim of first aid is to help preserve life, prevent further suffering, and promote recovery until the patient can be transported to the veterinary practice for full treatment. Carried out by a primary assessment by ensuring that there is danger for the patient and the first aider, that the patient is responsive, that they are conscious and breathing, and if any blockages need to be removed or if CPR is needed. It also helps to ensure that they have good circulation by checking heart rate, mucous membrane, capillary refill time to stop any external bleeding. Obtaining a brief history of the incident and assessing the extent of injuries is essential for proper veterinary staff. Information can include the name and address of the owner if the patient is a pet, telephone numbers, species, breed, age and sex of the patient, initial evaluation of the injury, time of administration, change of patient's status since administration, and the nature of the first aid treatment given. Handling different species makes it essential to understand their behavioural differences and to observe the animal's behaviour and body language. This will help prevent the animal from suffering any unnecessary pain and risk to the handler. Injured patients must not be moved until they have been thoroughly assessed to avoid any more injury. The only exception would be if the patient or the first aider's life. When moving patients, it is essential to handle them carefully, as the patients will be in pain, shock, and frightened if conscious, and spooking them can cause them to lash out, causing further injury to themselves or the first aider. As shown, these steps need to be taken to avoid any other unnecessary injury to both the patients and the first aider. There are different restraining equipment available for different species, which can be beneficial to use to capture an animal, depending on their injuries, including crush cages with a movable internal wall that can be eased across gently to hold the patient against the wire side of the cage. This form of restraint allows for injections through the wires. There are also muzzles and restraining bags, which are designed to zip up with holes to expose the head or the limbs as required. Graspers are another form of restraint, which grasp the animal by the neck, along with towels, which are beneficial as they can wrap up the patient, allowing for limbs to be exposed when needed. It is important when restraining animals that to use appropriately to avoid any risk of further injury. It is beneficial to have a first aid kit prepared in case of any health issues arising. This helps to ensure preserving life, preventing further suffering, and promoting recovery can occur. Such beneficial equipment to have a first aid box would be hand towels, saline solution, gauze and cotton bandaging materials, white surgical adhesive tape, sterile swabs, scissors and thermometers. Personal protective equipment must be used when providing first aid to patients to avoid any risk to injury. Such PPE for the first aiders should include thick leather gloves, as it helps prevent from scratches and bites, along with disposable gloves if there are any suspected zoonosis cases, which are diseases that can be transferred from animals to humans, along with disposable aprons and a face visor. On arrival, unless the injury or there is suspected head or spinal injury, the patient should be placed within the recovery position, which is that the patient should be placed on their right side, ensuring their head and neck is straightened and the tongue is forward, so it hangs out on the side of the patient's mouth. Any collar and harness should be removed for full access for the patient. It is important that post-operative observations for the patient is provided during the anesthesia and surgery, ensuring that the patient is clean, dry and made comfortable, observing their thermoregulation, cardiovascular and respiratory function, electrolytes, fluid balance and management of post-operative pain or discomfort. This ensures that the treatment to the patient helps to improve their health. A first aid example is hemorrhages. If a patient is bleeding out, this needs to be treated as an emergency. There are different methods of helping reduce the hemorrhage whilst the patient is in a veterinary practice where they will receive full treatment. Direct pressure is applied pressure directly on the hemorrhage site. This will help aid the natural clotting process. This is carried out through the pressing clean fingers or dressing if on hand. It is essential that the product used is clean to prevent the risk of infection. If the bleeding goes through the material, further dressing should be applied on top without removing the first material. This allows for the clots to continue to be formed without being disturbed or destroyed. Indirect pressure with pressure points around the body is where it is possible to pressure against the bone and reduce blood flow to the wound, reducing the blood loss. There are three main arteries that are commonly used: branchial artery, which lies on the medial side of the humerus, femoral artery found on the medial side of the femur, and the coccygeal artery found on the ventral aspect of the tail. A tourniquet can be used, which is a material tied to the wound of the limb, gradually tightening until the hemorrhage is controlled. These methods should only be used for short periods of 25 minutes and not be used for at least 1 minute of time, as it also cuts the circulation of all tissues below. Along with preventing this, it is essential that the wound is kept under observation at all times. Here are the references used to provide the information used within this video. The next videos contain different scenarios, including a wild hare suffering from heat stroke, a canine with a simple bone fracture, and a feline suffering from a poisoning. These will contain what first aid needs to be provided and how it